pleasure being with you as of once again. Your group has been incredibly amazing in the manner it's become the world's largest producer of vaccines in terms of dosages. How did you come to this business, and what made you tick where many others fell by the wayside?
Well, you know, when my father started in the 60s,
yes,
even he never imagined that we'd one day become the largest vaccine producers in the world. He wanted to address the issues of shortages as far as the masses were concerned, and he wanted to get into the line of business that addressed affordable vaccines and affordable healthcare, which wasn't available at that time, and even today we struggle in our country and many other countries to get access to affordable vaccines. I took that strategy forward. You know, I've been now in the business for the last 13, 14 years, and I took over as CEO in 2011. We have now embarked on concentrating on addressing and producing all the vaccines that Africa, South America, India, Asia require, and most importantly that are affordable. And what happened as a result of taking this strategy is that most of the other vaccine producers in the West walked out of, you know, making these vaccines, which are for less than $1. Okay. And now you see a lot of Indian vaccine manufacturers who have also come up and are producing the same vaccines that we're producing. Today we produce something like 1.3 billion doses of vaccines a year, but our turnover is just you know, $750 million. So you can imagine our average selling price is, you know, far less than $1.
So you're relevant more to the developing world.
Yes.
Okay.
We do have some new patents in vaccines that now we've partnered with some of our colleagues, and we're going to now launch some vaccines in the next 2 to 3 years in Europe and the United States as well. We've built a whole new, brand new campus. We've spent something like about 2.5 to 3,000 crores on developing EU and US compliant facilities, and of course to add some more capacity to the existing campus here. So including these two campuses, we've got you know, 2 more manufacturing sites in Europe, one in Czech Republic, one in Holland. We have spent more than 400 million euros over the last 5 years developing our capabilities over there, and that should start producing in the next year or two, also substantially adding revenues and also to the bottom line.
So which means that these new patented vaccines, you'll be entering the upper crust market as well.
Yes. We've got a bladder cancer vaccine that we already sell in Europe. We'll hopefully sell that one day in the US as well. We've got a bunch of other vaccines that are coming there, like for cervical cancer for women.
I've read about that, yes.
You know, we've got the pneumococcal vaccine, which we'll launch by 2020 for the developing world. You know, this is a major killer in children. Pneumonia is one of the highest killers of newborn babies. So we've also got a dengue monoclonal and dengue vaccine coming. So hopefully that will help.
For dengue?
Yes, yes.
Wow.
We're also in the business of monoclonals, which is basically an antibody and a cure for anything that you get. So far we launched the world's first rabies monoclonal antibody in India a couple of months ago. And
how would this be different from, let's say, GSK's Rabipur?
Well, they don't have one.
Okay.
This is a monoclonal. This is not a vaccine.
Okay.
So it's the first of its kind in the world. We partnered with the University of Massachusetts for this, and they have a biotech division which we partnered with. And also we've got the dengue monoclonal that we've got worldwide rights from a company called Vistera in the US. So in 2 years' time, we will be launching a cure for dengue. You know, when you get hospitalized, we just put you on a drip for 20 minutes and then you're cured.
Oh, wow. One question, as a layperson, what would the difference between a vaccine for rabies and a monoclonal?
So a vaccine is a preventive. A monoclonal is a ready-made human antibody that you give. Whereas the vaccine is generally a preventive that you take so that you don't get, say, cervical cancer, you don't get pneumonia, etc.
Okay, so this would be like any other vaccine that a child gets to prevent him from getting that disease later.
Yes, and a monoclonal is something that you give Usually, you could give it intramuscularly or on a drip in a hospital, which will prevent the disease from progressing and neutralize the virus.
Okay, so today how many vaccines would you have in your range in terms of approximate numbers?
Probably around 12 to 15. And we're launching at least 3.
These are new ones.
No. The new ones will be about 3 vaccines in 2020, and in 2022 another 2 vaccines then. So that will take us to close to about 15 to 16 vaccines in total.
How much did horses have got to do with vaccines?
Well, nothing really. It's just that, breeding horses was something that my grandfather was doing, and
Yes.
then my father decided to use that to generate anti-tetanus toxin and anti-snake venom serum.
That is where I learnt about
Yes.
how horse serum was used for anti-snake.
And then we used that, and that was the only connection to horses. And then, we went into making tetanus vaccine and so on, and other human vaccines.
So effectively, the serums that you use for anti-venom and
That was derived from horses.
yeah, that was from horses, but that got into the science of
Yes.
Would that be right?
Yes.
Okay, great. And today, if you look at your new investments for new vaccines, what will your investments be like?
Well, each vaccine to develop and take through clinics normally takes, usually as a general rule of thumb, somewhere between $20 to $30 million. That coupled with the capital expenditure that you need to put in, it's a very, very capital intensive activity, and it usually takes 3 to 5 years to develop. So you don't know if you've gone right or wrong, and you have to wait till 5 years to know if you made the right decision or not. So it's a very tricky business, and that's part of the reason why the barriers to entry are so high. No one wants to take risks that they don't really have full control over, and that's part of the reason why there's just a limited number of vaccine manufacturers that have succeeded.
Today, how many centers do you have for producing vaccines?
Well, we have 2 plants in Pune. We have 2 plants in Europe, as I mentioned, in Czech Republic and in Holland. Those 2 European facilities make bladder cancer vaccines and the injectable polio vaccine, which is a key product required for the elimination of global polio, to eradicate polio from the globe.
Oh, okay.
Because the oral polio has its issues, and that's why that's being phased out. And as companies slowly build up the capacity for injectable polio, the world will switch to injectable polio.
Okay. And you intend remaining the largest producer of that vaccine too?
Well, we're not the largest yet in injectable polio, but we should be in the next 2 to 3 years when our plants are fully functional, and at the moment they're just being qualified, and the regulators are just checking those facilities to see that they comply, and in 2 years' time we should start production there.
Excellent. Typically, when you become the largest in the world, you have the ability and possibly even the moral responsibility of setting standards for your country, which means that you become the leader of the industry, also guide the industry. Do you have any plans in that direction?
Yes, and that's why we are going to, we formed an association. We'll be talking about that in 2 weeks' time when we actually officially launch it. It'll be the Vaccine Manufacturers Association of India, which will put out the kind of information and messaging, and also interact, whether it's with the public or the medical fraternity, and as well as the government, to shape policy and shape the way the country needs to look at preventative measures like vaccines and other things to bring down childhood mortality and address so many other issues that are being neglected right now.
Brilliant. Now, how many vaccine players would there be in the country today?
Oh, there's probably 7 or 8, but I think there are 3 to 4 major vaccine producers, and I think a total of maybe 8 to 10.
Okay.
If you look at
when you talk about vaccines in a country, you're talking about standards, you're talking about processes, you're talking about the way a state should look at the industry. Are you going to be addressing all the three?
Yes.
Brilliant. Okay, that takes me to the second area, which I believe is a passion with you.
Yes.
And that's waste management.
Yes.
Could you talk to me about that?
Yes. We started this and launched it at the hands of our Honorable Chief Minister of Maharashtra 2.5 years ago. And this was a personal, it was beyond CSR. A lot of people ask me, is it CSR? We have spent 5 times the budget of our annual CSR budget on this, because this is what was required. In fact, we're still running short of funds. We're covering only half the city, which is about 450 kilometers, where we've got and imported machines from Belgium and Holland, trucks, about 170 of them now, which are going around the city picking up the waste. We've provided bins. We're creating awareness campaigns for the public to segregate their waste. And this was something that I thought, of course, it's the government's job, but they need to partner also with a private group in every major city, I think, and that's a workable model that we're trying to now replicate in other states. And we've got a lot of inquiries to do that, because you need the technology and the ability to implement all these things, which the government can't do. You know, they have their own political and other bureaucratic hurdles that they have to deal with. And so partnering with a private group such as ours, or so many others in other cities also who want to take action, is the way forward to address India's waste management. And of course, the ultimate is to convert the waste into energy.
Yes.
Instead of it just being dumped and piled up or landfilling,
which is a disastrous
for the environment and also the local people living in that area. It's being burnt, or it's just rotting over.
Either way, all the other alternatives are bad for health, bad for environment.
And another reason, I got into it because I just felt that I'm very proud to be Indian, but my pride always takes a little bit of a hit when I come back from my overseas visits, and you land, and from the time you go from the airport to your home or wherever you're going, you see all the filth around, and I just thought that it creates a bad impression and a negative impression. Definitely. And whether it's foreigners or investors coming into our country, what must they be thinking? And I just thought if we could try and improve that impression, and India has so much to offer, and sometimes certain aspects, can put you off. And that would be a real shame, because India has so much to offer, and I wouldn't want foreigners who come here to get the wrong impression and sort of rethink things.
What would your investments be in waste management and waste treatment?
We've spent about 100 crores so far, close to 100 crores.
OPEX?
Yes. No, it's CapEx and OPEX. We are spending around 2.5 crores a month on the OPEX, which is basically the maintenance of the vehicles and the staff. We've got 350 full-time people managing these machines and trucks. We've got 170 odd machines and trucks. So the OPEX is quite a bit, and the initial CapEx to buy all this also was there. So I just looked at the figures. It's very close to 100 crores now, which is what we forecasted 2 years ago. And we'll continue to support this, and hopefully, we'll have other partners who will also join in.
Okay, just one more question. This waste management, do you convert them to electricity? Do you convert them to methane?
Well, the plan right now is to use Swedish technology, which we found most suitable for our kind of waste.
Yes.
And they're the world experts. They import garbage and all that, and they convert a lot of that in their country to energy. Now, the government here in our country needs to look at a sustainable model that it can offer as a tendering process whereby it becomes sustainable for private operators to convert the waste into electricity.
And so some of it would go towards methane generation?
No, none of that is in that, because we haven't got land given to us by the government to process this.
Why?
You need land.
You need land, obviously.
And it's a very cumbersome process, but that we're talking to the highest levels in the state, and we are confident in the next 1 year we'll try to put up a project to.
We'll be glad to
process all
support
this
you and from pushing this idea. Why you need this to be
Yes.
done.
Yes, we need all the public support also
Yes.
to do it, because any new project coming up in an area would naturally have, because of the historical mistakes that have been made, there's always resistance, because of the mismanagement that's happened in the past. So any new project will need public support also.
Okay. Which other? Okay. How many people do you employ in the group?
Well, we've got 5,500 people in Pune, in Serum Institute, and another 600 people in Europe between the two plants there. We have another 350 to 400 in my Clean City initiative, and another 100 in our foundation, which is now providing clean drinking water. One hospital which is meant for the poor, and we give everything almost free there.
Wow.
And we've got 6
Where's
schools in the
Pune
it's in Pune, and we've got 6 schools now which are fully operational in the rural areas. One in Kolhapur, Baramati, Urli Kanchan, Alibag.
Excellent.
So we are doing things where these aren't centers of excellence, but this is the basic education that is required, that we're trying to address at the affordable level, including our healthcare and the hospital, which is not a very big hospital, it's just a 65-bed hospital. But, when you don't have a choice and you just don't have insurance like you have in the West, how does one pay for whatever you need?
Some way or the other, yes.
So we thought of providing that also to the people who can't afford a healthcare.
And are there any other activities that you'd like to talk about the group is doing?
Well, we're in the process of starting an NBFC to lend to businesses and to individuals.
Makes sense.
That's taking shape, and we're looking at an online platform whereby you can make payments. The whole world is going toward that now, so that you have an app.
Transparent and
you have an app where you can borrow funds, you can make payments, you can make your electricity payments, pay people, book hotels, do all of that. Which is what everyone is doing at the moment, and I just see that that market is growing so much
brilliantly
that there isn't
a lot of artificial intelligence coming in, so that you can.
Yeah, even though there is a lot of competition in it, but the market is growing so much, it just depends.
And especially now with the banks unable to lend money, the NBFC market is open.
Yes. So we're looking at deploying our funds which are not being used back in the business. We replow most of our profits back in our main business.
Yes.
But to get a better return than for your treasury income, we thought that starting a small NBFC and growing it would be the more prudent way of doing it. We were looking in the market to acquire some NBFCs, but the valuations were very high, and the profits these NBFCs were making were very low. They were just going to a loan to book ratio and asking for some ridiculous valuation.
Yes.
So we felt that it's better to just start our own, build our own team and do it.
So what's a startup corpus with?
We haven't decided that yet. It depends, maybe about 100 crores, and then we go from there. And very soon, once we have systems in place, then it's very easy to deploy. But we just want to make sure that our systems are in place, and then in a year's time, you could easily scale it up to 2,000-3,000 crores a year or two's time.
Brilliant.
Because of the way in which the market and technology today that's available. Once you have your system that is safe and is checking everything properly, then it's very easy to deploy.
Excellent. Any other activities? NBFC?
No, that's I think about it. That keeps me busy between my social work and my main business.
It keeps us busy. Now we've got more things to track.
So that's it for now, and we're very excited about the next few years where we launch these new vaccines and hopefully be able to save so many more lives.
Excellent. Thank you very much.
You.
I promise to keep you free by that time.
Thank you.
But thank you. Amazed and impressed.
Thank you very much.
Thank you.
Okay.